How does somebody initiate the conversation with their doctor about perimenopause, menopause, and maybe the joint pain that you have, such as frozen shoulder, is from something like a thyroid issue, a hormone issue, an unaddressed systemic issue that is causing the primary reason of frozen shoulder. Now remember, secondary frozen shoulder happens when there's an underlying issue like a rotator cuff tear or bicep tear. So how do you go about doing this? Well, number one, doctors do not like to be told how to do their job. So you have to finesse this situation, the conversation a little bit. First, think about this. You have, let's say, 7 minutes to say your symptoms and your subjective reports of pain, your objective measures of what is happening. So I would say personally, if you have a good rapport with that doctor, say, if we're going to talk about perimenopause, menopause transition, hey, I haven't felt like myself lately. And then you're going to list off the symptoms, such as, say, your early perimenopause. You feel off, you're fatigued, maybe you have joint pain, you're more anxious. And then the conversation might lead to, well, let's take a look at your blood work, because here's why. It could be that your thyroid is off. It could be that your vitamin D levels aren't quite right. It could be that you are having some other rheumatic issue and maybe your RA is rearing its head, but usually I think it's perimenopause. The blood work that one could look at to determine how close you are to reaching perimenopause is FSH and AMH. But nothing tells you that you're in perimenopause at the beginning. It just tells us when you're getting close to reaching perimenopause, and you reach menopause when you are 365 days since your last cycle. Now, not all doctors are trained in menopause. It is a very tiny little thing in med school. So some people find they have to talk to a couple doctors to get the care they need to feel better. This is where telehealth comes in, like MIDI Health, Alloy. These companies are talking to you because your greatest asset in this moment is your subjective report. What you say matters. But I do need you to come in with your symptoms. Not everybody knows that the widespread joint pain, the fatigue, all this tendonitis that you're getting is from perimenopause. Now, the next part is the most important part if we're going to be loving and educating to our doctors. You can even print this article out, because I believe it is a full access PDF by Vonda Wright. It is the musculoskeletal syndrome of menopause. Let me say it again. The musculoskeletal syndrome of menopause. It is a landmark paper. There are papers that come along in our life that change the trajectory of how we treat patients. And this is going to be one of them for women in perimenopause, menopause, because traditionally we just say, okay, postmenopause, you have bone density issues. But if we take the thought that the reason women who are on aromatase inhibitors have widespread joint pain is because the estrogen is sucked out of all those tissues. If we know that postmenopausal women are having a massive loss of elasticity, their bones are becoming more brittle, they're not strong, they're not flexible, it should have clicked to us that when women go through the perimenopause transition, their tendons, their ligaments, their fascia are going to have some issues. And sometimes, especially in frozen shoulder, getting to the root issue, whether it be your thyroid, whether it be your sex hormones, getting that systemic stuff fixed, it's a big deal. Now, when you look at research for frozen shoulder, your MD is actually very, very helpful for the treatment of frozen shoulder, because steroids are a gold standard treatment for the inflammation of frozen shoulder. Also, fixing the underlying issue, like if you have a low thyroid, taking a thyroid medication. If you have low hormones, taking something to support you. Now, menopause is estrogen deficiency, ovarian insufficiency. When you do hormone replacement therapy or menopause hormone therapy or hormone therapy, people call it lots of things. It's never the same. It's never the same. It's not a full-on replacement, but it can help you manage your symptoms and feel better. Now, as a physical therapist, I talk to you about, hey, I need you to go see your doctor. Something's happening. I need you to go talk to your doctor. But in the meantime, let me talk to you about your habits, your lifestyle, things that we can modify, such as, are you resting? Are you nourishing yourself? Are you moving your body? So I suggest you first write down in your notes a list of the symptoms that you're experiencing. Then ask for blood work. I'm sure they're going to offer it. check your thyroid, check your D. They can check your hormone levels, but they're going to tell you it varies because it does. They can check your FSH and AMH. And then if you want to be good, you could print off that article and take it to them and say, hey, have you seen this? Because research like that, that's gold. You got to share it. You got to tell people. Also, I personally love it when my patients bring me articles, and I actually miss the days when my ladies would clip out newspaper articles for me. Nobody clips out newspaper articles for me anymore. It makes me sad. I'm that old.